Optimum aesthetics can be achieved with implant crowns if the proper emergence profile is created. There are problems in establishing proper emergence profile. One is the diameter of the healing abutment, and the second is the shape of the healing abutment. This presentation will present 3 cases to show techniques in creating a proper emergence profile. In addition, a technique will be presented to reduce gingival excess cement on cemented implant crowns. The first case shows how a proper emergence profile can be created with a provisional implant crown. The crown post and core became loose on the maxillary right lateral incisor, resulting in decay of the canal and the remaining tooth structure. The tooth was unrestorable. An implant was placed, and the patient wore the removable provisional appliance during osseointegration. To develop a proper emergence profile, a screw-retained provisional crown was fabricated to allow for proper tissue healing. Resin was added to a provisional abutment to develop the proper profile. The provisional abutment with modified resin was placed in the mouth. A stent was fabricated from a maxillary study model taken prior to extraction. Resin was placed into the stent. The stent with resin was placed over the custom provisional abutment, ensuring that the screw access hole remained open. The provisional crown was removed from the implant. Resin was added to the voids that appeared on the provisional crown. The provisional crown was then polished and placed back onto the implant. Notice that the access hole here is well maintained, so it can be screw retained. The access hole is then filled with resin. The provisional implant crown is in place, contouring the tissue. The provisional crown has been in place and the tissue has healed to create the proper emergence profile. An X-ray view of the provisional on the implant. In this case, 2 provisionals have been used. One removable during the time of healing, the second to create the proper emergence profile. And the final restoration showing the emergence profile that has been developed by a provisional restoration. And the final view of the anterior region of the mouth. The second case will show how proper emergence profile can be created with contouring an existing healing abutment. The patient presented with a broken bridge from the maxillary lateral incisor to the first bicuspid. The case was complicated by the fact that the maxillary left cuspid was impacted. Radiographs of the bridge prior to breakage. A CAT scan was taken to determine the location of the cuspid and whether there was enough room for implant crowns. A pan was taken. Notice the impacted cuspid and the broken bicuspid. A study model shows the fractured bridge. The abutment teeth were extracted and 2 implants were placed. The implants were exposed after integration. To create a proper emergence profile, a conventional healing abutment was used, and resin was adapted to those healing abutments to contour the tissue to get a proper emergence profile. The modified custom healing abutments were placed on the implants. X-ray view of the modified healing abutments in place. The modified healing abutments now contour the tissue to create proper emergence profile. Custom abutments for the final restoration are fabricated and placed. A provisional restoration is placed on the custom abutments to ensure proper tissue contour. After additional healing time, the final restoration is placed. The third case will show a contoured healing abutment developing the proper emergence profile. The contoured healing abutment has been pre-shaped to the dimension and the emergence profile of the particular tooth that has been involved. In this case, the upper right lateral incisor has been broken off at the gum line. The tooth was extracted and the implant was placed in the extraction site. Now a contoured healing abutment designed for the emergence profile of a lateral incisor is screw retained to the implant and modified to develop the proper tissue height. The abutment is then reduced to the gingival height. Gutta percha is placed in the access hole. And after healing, a final restoration is fabricated to the proper emergence profile. A technique will now be presented to show how to reduce gingival excess cement on cemented implant crowns. The gingival sulcus around the implant crown is often more than 3 millimeters deep, allowing cement to harden below the gingival margin. Removing this hardened excess cement is difficult, causing irritation to the tissue. If not completely removed, the excess cement will cause chronic tissue irritation. On a cemented implant crown, a custom abutment has been fabricated, and then the final restoration has been developed to that custom abutment. Foil is placed into the final restoration to act as a spacer. Then a putty analog is developed for the implant crown. This shows the implant crown and the putty analog. Permanent cement is placed in the implant crown and the putty analog is placed into the crown. Excess cement will extrude out at the margin and is wiped away. The final restoration is cemented with minimal cement This study will show the benefits of using a contoured healing abutment to develop a proper profile. Here, an impression coping is used that is the same diameter as a normal round healing abutment. This is an impression coping used of a contoured healing abutment. Here is the emergence profile that will be developed from a normal, uncontoured healing abutment. Here is the emergence profile that will be developed from a contoured healing abutment. This shows the difference in space between a normal healing abutment and a customized healing abutment that then will allow the proper emergence profile.